This is Dr. Ayaz Shah, and I'm a dermatologist, a cosmetic dermatologist and laser surgeon here in Orlando, Florida. And we do various procedures. Our practice is built mainly around dermatology. Nowadays, there's a lot of requests for various procedures, and I wanted to introduce some of the key things that a dermatologist may be doing nowadays. We're based here in Dr. Phillips part of Orlando, Florida, and we do various procedures. One of the most sought after treatments, and we get phone calls, is for various laser procedures and for hair loss and skin whitening. These are by far the most popular sought after procedures. So one of the things that I thought we would introduce in this video as an introduction would be low-level laser therapy. So low-level laser therapy, or called LLLT, is where we treat hair loss. So people that are suffering from hair loss, men and women, that are suffering from hair loss, if it's not scarring alopecia, if the workup is negative and it is determined that they have androgenetic alopecia or telogen effluvium or any of those type of hair loss, which is non-scarring, then low-level laser therapy has been found to be quite effective. So lasers are one option, and we can go into greater detail when you visit our office, and we have a trichologist on board who will go into the A to Z of hair loss, and will determine if laser therapy is the appropriate option for you. The other procedure that we frequently get calls for is for skin lightening or skin whitening. So people have, examples are where they have hyperpigmentation, where the skin is too dark, which you get dark macules or patches on the face. Sometimes they call it the mask of pregnancy. It can be seen after pregnancy or using birth control pills, etc. So these are the two most common reasons. Also, sun exposure and environmental damage can lead to hyperpigmentation. It's a very difficult condition to manage. It can be epidermal, dermal, or mixed, and sometimes, depending upon what level of, what type of melasma this person has, sometimes the standard therapies such as bleaching agents or creams or chemical peels may not be very effective. Laser is definitely not recommended for these type of procedures or for melasma or hyperpigmentation, as that usually will worsen the condition. Most of these lasers are hot lasers. They generate heat, and it will cause subsequent post-inflammatory hyperpigmentation or worsening or darkening of the skin. So these are some things to take a note of. We have unique therapeutics, and one is centered around using glutathione, which is a very unique novel agent, and it's known as the master antioxidant. So it will help in many ways. One of the side effects of glutathione is that it does lighten the skin, and it converts the melanogenesis pathway from eumelanogenesis to pheomelanogenesis. So if we have enough sulfur basically on board, sulfur is one of those trace minerals which, if it's essential and in high amounts in the body, will convert the pathway of melanogenesis from eumelanogenesis to pheomelanogenesis. So glutathione, along with other unique therapeutic options to lighten the skin and the body. So if you call our office, we can let you know if you're the appropriate candidate. Any of these things begin with a consultation with one of our qualified skincare specialists, and please give us a call to see if we can help you.